Do I have your permission to use this video on my website for a review of post-op instructions for hip replacement patients?
Absolutely.
Okay, then maybe this will benefit all of my patients because you're extremely well detailed and organized, so I think this is the perfect situation. So let's go ahead with some of your questions.
Okay, you gave us a prescription. You gave us a prescription for the enoxaparin 40 milligrams syringes. Do I start that tonight?
Yep, you start that tonight. We're using the enoxaparin, which is Lovenox, to help prevent blood clots. So in this particular situation, we want to prevent blood clots. Other people use aspirin, Coumadin, warfarin, but in this case we chose it because we think it'll be more effective after discussing the options, and we'll use that once every day in the evening, and we'll do that for about 14 days to begin with. And then after that, we'll probably resume one aspirin a day for another 2 weeks.
Thank you. Do you recommend that he wear decompression stockings?
The decompression stockings are mostly for ankle swelling. They're very difficult to put on and off. If you've noticed that the ankles start swelling, then I think it's a great idea. If you don't think they're swelling, then it's probably not worth your while doing it. But moving the ankles back and forth, up and down, helps prevent swelling as well. Putting a pillow underneath the knee may help prevent ankle swelling. But keep an eye on the calf, and if the calf becomes more swollen, yes, put on the compression stockings. And if there's also pain behind the calf and swelling, then that's a blood clot until proven otherwise. That's considered an emergency. Then we need to get an ultrasound to look for blood clot, which can happen even though he's still on the Lovenox or enoxaparin.
So don't even use the low aspirin.
Well, I don't think we should use the low aspirin and the Lovenox because then you may get into a hematoma. So we usually choose one or the other.
So you gave him a prescription for oxycodone once we go home. But should we try the extra strength Tylenol first and see if that does it for him?
Yes, I like your suggestion that you should always try the medication that's the least powerful to begin with. So my motto is less is more. So try Tylenol extra strength, and then if that doesn't work, maybe use half of the oxycodone before you use a full pill to help prevent post-op confusion, post-operative constipation. So I think oxycodone does have a lot of side effects, so you always want to try something less potent to begin with.
Okay, thank you. He likes to sleep on his left side, and that's where the incision is. Should he not sleep on his left side?
I don't think he should sleep on his left side until the sutures that I put deep in the incision kind of allow the incisions to heal a little bit more. So I don't want too much tension or shear on the incision. So for the first 2 weeks, laying on his back, laying on his right side, probably is preferred.
Should he use ice packs?
The ice packs are recommended. So put a towel on the incision and then put an ice pack on the towel. And just use it maybe 10-15 minutes at a time, once or twice a day. Use your judgment.
Some of the instructions that were here in the hospital say with a front hip surgery, it says don't step backwards with that leg.
Yep, whenever we do the anterior approach, which you had done, we never want to hyperextend the hip. So we don't want the hip to hyperextend. So that was where that instruction came from. So I think it's a reasonable thing not to step backwards, but with these kind of anterior hip approaches, I think you use pain and comfort as your guide. We don't really have any real restrictions with the anterior approach. We just say use pain as your guide, and when you walk backwards, be careful that you don't fall because of a fall risk.
Okay. One last question about exercising. What kind of exercises should he do? Any breathing exercises?
Breathing exercise is very important, deep inspiration, and use the inspiratory spirometer that was given to you in the hospital where you blow the ball up and down. Always move your arms, always move your other leg, move your ankles, pump your ankles up and down, tighten your muscles as much as possible. You can put your full weight on your leg and you can sit normally, but don't sit on low chairs, low toilet seats, things that are struggle to come out of. In terms of your particular instructions, you can put full weight on your leg, but you don't want to do any deep knee bends, deep squats, any of that kind of torque on your hip for the first month until the body grows into the implant.
Okay, I think that's it. Thank you so much.
No, I thank you, because I'm going to put this on my website with your permission under my post-op instructions so that patients before the surgery can review it. So after the surgery, we can review it one more time so there's no confusion. In this particular situation, we're extremely happy and proud that we have a wife that can come down, a spouse that is an extra pair of eyes that can take care of things. Anytime a patient has an extra pair of eyes and support, usually things go fabulous. So thank you very much.
Thank you.